What we have observed is that over a third of patients who have lung cancer don't meet the criteria for lung cancer screening because they're never smokers. And then even patients who may have had remote history of smoking that constitute another 15-20%, they don't meet the criteria for lung cancer screening, but they are getting lung cancer. So we put this center together to help us improve awareness about these issues in the community, and if patients want to get tested, they have a mechanism through us. We will work with their insurance companies, and if they provide coverage, great. If not, then we will get these patients who meet our criteria for screening screened using the support of John and Rita Canning's philanthropy. This whole program is based on our efforts for early detection of conditions in the chest. If you think about it, lung cancer is the biggest cause of cancer death in the country. And in a paper that is going to come out from Northwestern, we evaluated about 1,000 consecutive patients who were diagnosed with lung cancer at Northwestern, and we found exactly that, about 50% don't meet the criteria. If you associate risk with screening, it always is a deterrent for patients to seek screening because there is a guilt that gets associated. So patients are often in denial. They don't want to accept that this may have been caused by some of the behaviors that they have in the past. But if you change the narrative and say, listen, this is part of a broader health screening initiative, then you're more likely to get patients entered into screening and detected early. Because ultimately our goal is to bring a national change where we can convince the US Preventive Services Task Force, which is a federal government entity, to expand the lung cancer screening so that we can detect lung cancer and frankly other types of respiratory conditions earlier. If we extend the screening from 40 years onwards and go away from risk-based screening, we could really capture most lung cancer at early stage. Now, we are going to have to incorporate that in clinical practice and improve awareness, but assuming that we could make that change and assuming that we can get people to screen, we can achieve our goal of detecting lung cancer at an early stage more than 80% of the time if that model was followed.